What if aging isn't actually a natural process? What if aging is a disease? And what if the cells in our body aren't really dying? They're just falling asleep.
Now imagine if scientists could wake those cells back up. What if one day you could stay youthful far longer than we ever thought possible? Maybe even cheat death itself. Sounds like science fiction, but something very interesting is happening right now in a completely unexpected field. Hair loss. There's a new experimental drug being developed by a company called Pelage Pharmaceuticals. The drug is called PP405, and it's designed to treat androgenetic alopecia, also known as pattern baldness, in both men and women.
Now, you might be thinking, hair loss? That's it? But this drug is getting a lot of attention in the biotech world, and not just because millions of people want their hair back. The reason scientists are excited about PP405 is because of how it works. But before we get into that, let's look at where the drug currently stands. Like every pharmaceutical drug, PP405 has to go through several clinical trial stages before it can ever reach the market. Typically, there are 4 phases. Phase 1, safety and dosage testing. Phase 2, testing effectiveness and side effects. Phase 3, large-scale confirmation. Phase 4, monitoring after the drug is approved and used publicly. Right now, PP405 has completed Phase 2A trials, and researchers are preparing for Phase 3 trials expected around 2026.
So, what did we learn from the early trials? The Phase 2A study included 78 men and women with pattern baldness. Participants applied a topical gel containing PP405 to the scalp once a day for 4 weeks and were monitored for 12 weeks.
The results were surprisingly fast. After just 8 weeks, about 31% of men with more advanced hair loss experienced over a 20% increase in hair density. The placebo group? 0 improvement.
Even more interesting, researchers observed new hair growth and follicles that previously weren't producing hair at all. And importantly, the drug showed no systemic absorption in the bloodstream, meaning it stayed localized on the scalp.
So, early results look promising. But the real question is, why is this considered such a big breakthrough? To understand that, we need to look at the current solutions for hair loss. For decades, the 2 most common treatments have been minoxidil and finasteride.
Minoxidil works by improving blood flow to the scalp and stimulating follicles.
Finasteride works very differently. It blocks an enzyme called 5-alpha reductase, which converts testosterone into DHT, the hormone largely responsible for shrinking hair follicles in genetic baldness.
And to be fair, these treatments can work very well for many people.
But they come with trade-offs. Finasteride, for example, affects hormone pathways. Some studies suggest around 2 to 3% of users report sexual side effects, though rates are similar to placebo in many trials. In rare cases, some patients report persistent symptoms, often referred to as post-finasteride syndrome.
So while current treatments slow hair loss or maintain existing hair, they usually don't regenerate new hair from follicles that have already stopped producing.
And that's exactly where PP405 is different. Instead of targeting hormones, PP405 works directly at the cellular level. The drug blocks something called the mitochondrial pyruvate carrier inside hair follicle stem cells. That might sound complicated, but the idea is actually simple. Hair follicles cycle through phases: anagen, growth phase; catagen, transition; telogen, resting phase. In people with pattern baldness, many follicles don't disappear. They simply get stuck in the resting phase. They're still there, they're just inactive. PP405 appears to shift the metabolism of those stem cells, pushing them from the resting phase back into the growth phase. In other words, it tries to wake the follicles up. That's why researchers describe PP405 not just as a hair loss treatment, but as a regenerative therapy. Another reason PP405 is attracting attention is because many previous attempts at regenerative hair treatments have failed. One well-known example is Samumed, now called Biosplice Therapeutics. For years, the company worked on a drug called SM04554, which was also supposed to regenerate hair by activating specific cellular pathways. The hype was enormous, but after years of trials, the company eventually stopped developing it for hair loss. This is common in biotech. Many promising drugs fail somewhere along the clinical trial process. So scientists remain cautious about PP405. Phase 2 results are encouraging, but Phase 3 trials are where things get serious. That's where thousands of patients are tested across longer periods of time. And that's when we will really know whether this drug works consistently. So will PP405 completely cure baldness? Will nobody be walking around bald in 2030? We honestly don't know yet. The Phase 3 trials expected around 2026 should give us much stronger answers. But what makes this story interesting isn't just hair loss, it's the bigger idea behind it.
Remember the question from the beginning? What if aging isn't just a process? What if it's something we can treat? PP405 works by reactivating dormant stem cells.
And that exact concept is being explored in many other areas of medicine right now. Labs and biotech companies around the world are studying ways to reset cellular aging, repair damaged tissues, and restore function to organs. One well-known example is Altos Labs, a company focused on cellular rejuvenation and age-related biology. The goal isn't just to treat disease after it happens. The goal is to repair the body before it breaks down. Imagine an 80-year-old with the organ health of someone in their 40s. That might sound impossible today, but scientists are already experimenting with ways to reprogram cells back to a younger biological state. And if that research continues to progress, medicine could eventually shift from treating disease to preventing aging itself. That future may still be decades away. But sometimes the first signs of a medical revolution show up in the most unexpected places, like a hair loss treatment. So what do you think?
Could PP405 really change the future of hair loss treatment? Or is this just another biotech promise that won't survive large clinical trials?
Let me know what you think in the comments. And if you're interested in the future of medicine, AI, biotech, and the technologies that might completely reshape our lives, make sure you subscribe.
Because the future is arriving faster than most people realize, and we're going to explore it together. I'll see you in the next one.